My name is Annette Cyr. I'm chair of the board for the Melanoma Network and founder of the organization. Were any of you here last year? Do we have any repeat offenders come on with us? Thank you. Well, first of all, it's always good to see melanoma patients coming back. That's a very good sign. And for all of you that are new and joining us this evening, welcome on behalf of the organization. We have some great speakers tonight, so I'm not going to spend too much time with details. Just a little bit about the Melanoma Network. We're a national organization, a charity founded in 2009 to help provide support services for melanoma patients, as well as try to put some prevention, right? We need prevention, Dr. Miller, right? Absolutely. We think that there's much more value in preventing this disease than there is in treating it, and certainly we're very happy to hear about the treatments and such, but we know for a vast majority of melanoma, a lot of that can be prevented. So a lot of our efforts, which I'll talk to you a little bit about tonight, are focusing as well on prevention. And as well, we try to be a strong voice for advocacy, and that is for access to drug therapies. Many of you have been on different forms of therapy, and I hope they're working and being successful for you. Right across the country, we have quite a diversity of access issues. Unfortunately, Canada's medical system is quite unique, and each province manages their healthcare differently. So it doesn't always mean we always have the same access to therapies. And I think Stan, who's going to speak again this evening, if you were with us last year, you would have had the pleasure of hearing about his story. He's going to tell a little bit about that, but he will attest to the quality of the healthcare and the treatment that he's received in the province here as well. So we're celebrating 9 years this year. We're going to be heading into our 10-year anniversary next year, which we're quite excited about. Any organization that can sustain 10 years, I think, is a good sign. But we've had a lot of achievements along the way, which is also things like getting tanning bed legislation in most of the provinces. We've participated in very actively, and we're very successful with that. We've got some of the best resources as far as information sources for melanoma patients across the country. We're very proud of our peer support program, which if you haven't taken advantage of that, please feel free to contact us, which is a program that we try to connect patients that have had similar diagnosis. So basically can share some of your stories and hopefully provide some information and support for each other. We've got some support groups operating across the country as well, and we do a lot of patient information sessions, which are to try to reach patients and connect patients right across the country. You know, it's sometimes very isolating to be diagnosed with cancer, and yet one that's a little bit rarer than some of the more common forms of cancer. I know too, as a patient, I was diagnosed in 2000 with melanoma, so 18 years later I'm still here, thankfully. But you know, had several recurrences along the route, which was really quite frightening, and I think challenging at best. You know, you kind of think you got it beat once, and it comes back and back and back. So thankfully, you know, I've received great care along the way, and I'm here to talk about that. And we certainly have had our share of melanoma. So you're not alone. That's one thing we want to get the message out for patients, is that there are support services available, not only at Melanoma Network, but hospitals themselves have a lot of support services and great avenues to access support. But we like to think that we provide that more customized approach, and we do certainly try to link you up with people that have been in your shoes. So recently, you know, we helped a patient out in Alberta get access to a drug therapy that he was having to pay for out of pocket. And in our newsletter, you'll find a little story about that, where he was having to pay almost $13,000 a month for therapy, and had metastases to his brain and such, and couldn't get the government to cover it or through clinical trial, and was facing some pretty dire circumstances. And I'm glad to say I just spoke with his wife last week to check up on him and how he's doing, and because of our intervention and being able to get him coverage for that drug therapy, he is now stable. His brain metastases are stable, and he's doing remarkably well responding to treatment. So it's those small interventions that we can sometimes help with as an organization that really make a big difference in people's lives. So I know your doctors are the first line of defense and always at your side trying to make sure that you've got the best and most quickly accessed treatment, but sometimes we need some other pooling of resources to be able to get those things happening. So as I mentioned, we do receive over about 2,000 support calls annually, so we get a lot of inquiries from patients right across the country, patients' families, friends. We get lots of out-of-country calls as well, which says something about Canada. We have more than a lot of countries in the world, but we still have our challenges with getting timely access for patients. And we do provide, as I said, patient workshops, support groups, and a bunch of resources that patients find very valuable. Again, if you're interested in the peer support program or if you want to volunteer to become a peer support, we always need good volunteers that have been through or have experienced different forms of treatment and are interested in sharing that or becoming a support for other patients. And it's a way of paying forward, so to speak. Mentioned prevention. Well, we're heading into a hot weekend again, and it's been a kind of an up and down summer and such. And I don't think I need to preach to the converted here about sun safety. Everybody kind of got that message, I think, hopefully. Yes. Well, and no skin type is immune from issues with the sun. Obviously, the lighter your skin tone, if you've got light hair, light eyes, red hair, if your skin freckles, if you burn easily, you're at a higher risk profile for a UV damage and UV radiation. The darker your skin tone, of course, you've got higher degree of pigmentation, which does provide some degree of protection, but there isn't a person that hasn't got a risk factor, so it's always important to consider sun protective measures. We gave out free sunscreen, but that's just a reminder to not only wear sunscreen, but the best way is through seeking shade in those peak hours between 11 and 3, wearing a hat wherever possible, sunglasses to protect your eyes that are UV, not the ones at the dollar store, but the ones that actually have the UV protection in them as well. And UV protective clothing. You don't have to go out and spend money on UV protective clothing. There are some great clothing lines that have built-in factors they call a UPF, ultraviolet protection factor 50. Those are great. Some of them are very light and airy for the summer and keep you cool as well as protect you from the sun. But really any type of clothing that has a tighter weave that you can't see through if you hold it up to the sun is good protection. So if you're not going to be applying sunscreen when you're out and about, do try to cover up as much as possible. We know that thousands of deaths in Canada each year are related to skin cancer and could be avoided if we had a national program to increase screening and also increase the education for frontline physicians. And we're hoping as an organization that we will be able to undertake something like that within the next few years. So, and there's also the tanning bed issue. I know none of you are venturing into tanning beds, so that's a good thing, but we'd love to see them totally banned. They are carcinogenic and they cause significant health issues and pose risks for everyone using them. So hopefully someday we'll see that completely banned, but we know the access is limited at least to over 18, but there is no such thing as a safe tan, and tanning beds are certainly not the avenue to get a tan. And we also know that there is a lot of education, as I said, that we need to do at frontline physicians. There isn't a great degree of knowledge of what to look for on the skin, or the time sometimes to even provide patients with information about sun safety, or when they see you there in your annual checkup, if they're looking to see if you've got sun-damaged skin or signs of tanning, and whether or not to be able to provide a word of caution about that. And hopefully we will look to try to develop an educational program in the future for our frontline physicians. We have done some great initiatives in Ontario, funded by the Douglas Wright Foundation and ourselves on the summer camp programs for youth. So we've put in, oh gosh, I think over the years we're probably getting close to 500,000 children have gone through some form of education around sun safety. wearing sunscreen, hats, etc. While at camp, a lot of the exposure they get is during those summer months at camp. Although exposure is all year round, there's intense periods of sun exposure when children and youth are at camps. So we're trying to instill in them a foundation of sun-safe behavior, and that you can still have fun outdoors and still be sun safe. And that camp program has gone extremely well. And last year we won an award from the Canadian Dermatology Association for that program. So we're still working with federal and provincial governments to try to up the ante and try to push for access issues for coverage, I guess, provincial coverage, and also from private organizations for coverage for the different drug therapies. It's not a slam dunk in some of the provinces, and we're still waiting for approval of a few therapies. Some of the interesting things that are coming down the pipeline are adjuvant therapies. So some of these new treatment therapies that are available for metastatic patients or unresectable stage 3 and above, stage 3C and above, will be hopefully being brought down to the adjuvant level for earlier stage 3 patients. So you'll be looking to hopefully get a survey from us in the upcoming months that is going to help us prepare drug submissions for a couple of the adjuvant therapies, the targeted therapies, in the fall. So you'll probably be getting an email from us on that. And then this fall, we do our annual fundraising drive, which is our Strides for Melanoma Walk, and it's in Mount Royal Park. It's a great time from everybody that's attended, and we've been doing it for quite a number of years here. So we welcome you to join us out there, and hope you will join us. It's our major source of funding as an organization, and we welcome your attendance and really encourage you to sign up online. Let us know if you have any trouble, but please get a team together and help support us and support continuing education and promotion of this disease. We need ongoing investment in research, and that's the other thing I think a few of the physicians are going to talk about tonight, some of the research that's going on. We're happy to let you know that as an organization, just about every year since our foundation, we have provided funding for research in the province of Quebec, which I can't say about any other province in the country. So we funded over $250,000 in research at McGill, which just the research project just ended last year. And we've provided another grant this year through Jewish General Hospital. So we're pleased to support some ongoing research in a rare form of melanoma, which I think Sonia will talk about, which is acromelanoma. So I think we're doing a little bit for each province is what we can manage to do. So hope you will join us for the walk in September.